Hey, it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to talk about what you should do at every single Invisalign or ClearCorrect appointment to avoid refinements, and it's really quick and easy. So, a lot of doctors, they just have their patients come in, they're wearing their aligners, they say, open, they see that they're tracking really well. I mean, obviously, hopefully you guys know what tracking means. They should fit like a second skin, like a glove. There should ever be any space between the aligner and the tooth. If there is a micro space, they need to use their chewies to get it seated. The 1 week or whatever the 10 days doesn't even start until it is fully seated. So you can't just say change it every 7 days or every 10 days because it should vary depending on how it is. If the tracking is not able to be eliminated after those 7 days, they need to stay in the aligner longer. They should not ever change to the next aligner until they get it seated for 7 days. If they still can't get it seated for 7 days, then they need to go back to their doctor and have a refinement done. Okay? So that's that. And then what you need to do at every appointment is when they come in is you need to take a set of photos with the aligners in, slightly open, front, side, kind of like what's happening here. Not so great, but not with the elastics on. Okay, so 3 photos with the aligners on, slightly open, not biting down, with retractors, side, front, okay? And then another set, a full set of 5 photos, okay, so it's 8 photos in total, using articulating paper first to mark the contacts. We want to make sure that the contacts are making sense. So for example, if we're marking the contacts, and this would be with the aligners out, if we start to see a posterior open bite happening or an anterior open bite happening, or lack of contact when we had contact, that's where we're like, we should probably stop and refine. Because if you have these issues happening, you're only going to notice if you're using articulating paper. And you're only going to notice if you're taking pictures with retractors with the aligners out as well, and then comparing it to the ClinCheck and where they started. So you got to take that 5 to 10 minutes to figure out what's going on. And sometimes, even if they're tracking, sometimes you're going to have to do a refinement. So it's really important to do that. Now, this could totally be done virtually ahead of time. There's no reason you have to do this in office, especially if you give your patient a pack of articulating paper and retractor, photo retractors. This really only costs like $1.50. You can give it to them in a goodie bag and just tell them to send in. There's a variety of different HIPAA compliant ways and systems. You can even create your own in-house system if you want to, as long as you're doing HIPAA compliant, where the patients are going to send you that set of photos like about a week before their appointment. And you can look at those photos and basically they probably don't even need to come in, if everything's going well. You could even skip the appointment. You could even mail the aligners if everything's going well. And you'll have an idea. Do I need a refinement? Do I not need a refinement? Is the patient super compliant? How many more aligners can I get? If a patient is super compliant at that point and has got the hang of it, they can have 10, they can have 20 aligners. I don't care. They got it. They understand what they need to do. This is not rocket science. You just got to keep your eye on the bite and your eye on the tracking. That's about it. And if there's teeth erupting, keep your eye on those. But yeah, if you do that every appointment, you will probably not ever need refinements, as long as you do your IPR well and your patient is wearing their aligners. All right, thanks.